without any further ado, I'd like to invite Dr. Vance up to say a few words, and then we'll introduce our senator.
Thank you, Shelley. It used to be said that if the apocalypse came, then you wanted to be in Southwest Georgia because it wouldn't get here for another 10 years. Well, unfortunately, this was not the case when a real apocalypse came to Albany, Georgia, a little over a year ago in the form of the COVID pandemic. Albany had the unenviable experience of being one of the first areas in the nation to experience the ravages and the tragedies of coronavirus. But now, more than a year later, despite all of the sickness, all of the death, all of the sadness, we now have light at the end of the tunnel in the form of 3 very highly effective and very safe vaccines. As the Chief Medical Officer for Albany Area Primary Healthcare Incorporated, or AAPHC as we call it, I can say that I am proud that we have given over 9,000 shots into arms as of yesterday. This is for our community and our patients. These vaccines will play a major role in helping to lead our community out of this pandemic. Once the vaccines became available in late December, AAPHC immediately went into action to fulfill our mission as a community health center, which is to provide quality health care for all patients, regardless of their ability to pay. Through the Herculean efforts of our CEO, Shelley Spires, our Director of Nursing, Rhonda Arline, our Vaccine Coordinator, Shirley Hart, and countless others, AAPHC was able to quickly stand up vaccination clinics within 2 of our primary care locations. Additionally, our Chief Quality Officer, Joycelyn Yates, worked overtime to stage 2 very successful pop-up vaccination sites at Monroe High School here locally in Albany in both February and March of this month. And to honor Martin Luther King, AAPHC had its very first mass vaccination day on ML King Day in January, where almost 500 people were vaccinated while others were at home enjoying their day off. Realizing that a large site will be required for what has become routine mass vaccination to keep up with Georgia's expanded vaccine eligibility criteria, our CEO, Shelley Spires, collaborated with our community health partner, Scott Steiner, and the Phoebe Health System to secure use of this very building that we're at today. Additionally, she collaborated with our community health partner, Dr. Charles Ruiz, and the Southwest Georgia Health District to make sure that we had adequate supplies of vaccines at all times. These efforts at mass vaccination shows that AAPHC lives by our values of compassionate care, community connection, and continuous improvement, or as we at AAPHC know them, the 3 C's. Again, the most important outcome of these 9,000 vaccinations that AAPHC accomplished is that ultimately thousands of lives will be spared and thousands of hospitalizations will be prevented. And for this, we should be proud. Thank you.
Good afternoon, everybody. Thank you so much for being here. I want to thank you, Shelley, and you, Dr. Vance, for your extraordinary leadership, for all of the work that you're doing to strengthen public health in this community, to serve the people of Albany and the surrounding areas with this vaccine and with the vital healthcare services that you provide year-round. Thank you for that work. Thank you to the whole team here. Please join me in giving a round of applause to the team here at AAPHC. My message today is very simple, and that is that after such a difficult year with so much pain and displacement and agony and so much loss, and this community in particular has been hit so hard by this pandemic, there is, as Dr. Vance said, light at the end of the tunnel, represented by these extraordinarily effective and safe vaccines. The message is now is the time to make an appointment to get the COVID-19 vaccine. I've been vaccinated. My wife, Alicia, who's a doctor, has been vaccinated. Millions of Georgians and hundreds of millions of Americans are accessing this vaccine. And take that step to protect yourself and your family and our community, because that's how we beat this virus, is by following the advice of medical experts. That means continuing to wear masks in public, avoid crowded indoor gatherings, maintain that distance, and above all now, go and get that vaccine. It's safe, it's effective, it's free of charge, it's available to all Georgians 16 and older. And pharmacies across our state, clinics such as this one, as well as the mass vaccine sites that are being run by GEMA and FEMA are all excellent ways to access the vaccine. I also have a significant announcement regarding investment in public health right here in this community in Albany. And again, I want to acknowledge how hard Albany and Dougherty County have been hit by this pandemic. This was one of a few epicenters in the whole world for a while in terms of how intensely this virus was ravaging the community here. And with all of the resilience that Albany is known so well for, you guys persevered and pushed through and were there for each other. And now, Senator Warnock, we want to do our part to be here for you and to make sure that this community has the resources necessary to defend itself and to look out for public health. So it is with great pleasure that I can announce that this facility, that Albany area primary health care, will be receiving $8.8 million in funding. $8.8 million in funding thanks to the American Rescue Plan Act, which we passed in the U.S. Senate just a few weeks ago. Community health centers, which, as you all so well put and observed, provide health care to all, regardless of their wealth and their means.